vulgaris. Acne vulgaris is the medical term for simply acne. Oh, how do I? Oh, okay. So this is just a summary of my presentation. It's what we'll be covering. What is acne? Who does it affect? The types of acne, what causes it, physical symptoms, how to treat it, and just some myths at the end. So what is acne? Acne is a very common skin condition that presents through inflammatory and non-inflammatory skin lesions, most commonly on the face, chest, upper arms, back, and the neck as well. The lesions, they can appear as pimples that contain pus, pustules, or pimples that don't contain pus, papules, and comedones known as blackheads and whiteheads. In severe cases of acne, there can be cysts and nodules that form under the skin that can result in scarring. Pimples and pustules can also result in scarring, but this can be more severe and they're usually painful. So who does acne affect? This is just a graph that shows the prevalence of acne reported by age. So acne affects around 85% of people aged 12 to 24, but you can get acne at almost any age. Acne in people 40 plus is considered rare, but over 25% of women and 12% of men report having acne in their 40s or later. Also, neonatal acne can be developed in newborns. It usually appears around week 2 to 4 after they're born. The categories of acne, there are a couple, but I have cystic acne, which is deep pus-filled pimples and nodules. These can be very painful and cause lasting scars. This is considered more of a severe form of acne. Hormonal acne, it affects teens and adults who have overproduction of sebum that clogs their pores. Hormonal acne can really happen at any age depending on your body. Fungal acne, it occurs when yeast builds up in your hair follicles and these can be itchy and inflamed. Then there's nodular acne, which is one of the most severe forms of acne, and it causes pimples on the surface of your skin. They're tender and very firm lumps under your skin. And then neonatal acne, which are breakouts on newborns that appear around week 2 to 4 of life, and they usually clear up on their own within weeks or months. So these are just some photos of types of acne. So the top are pimples. These are more pustules. The photo at the bottom left is a cystic acne pimple or lesion. And then on the right are blackheads. So what causes acne? Acne develops when hair follicles get clogged with oil, dead skin cells, and bacteria. Hormones may explain why acne is so common in teenagers because the androgen hormones increase the size of your oil glands that result in an increased production of oil, clogs your pores, and will cause acne in some people, most people. One study found also that smoking can play a role for some women, also men with acne. The study shows that whiteheads and blackheads often cover a large area of your face as well as pimples. Smoking can also constrict the blood vessels. And then some studies link particular food and diets to acne. So milk, white bread, baked goods, high sugar diets. Lots of people who consume these products and have this type of diet will suffer from some acne at some point in their life. Physical symptoms are what you see on the face, the neck, the body, the back. Papules and pustules, inflamed raised bumps with or without yellow or white tops filled with pus. Papules have no pus and pustules do. Whiteheads and blackheads, they're tiny bumps that can be dark or white. And then cysts, they're bumps under the skin that are often painful. Post-inflammatory hyperpigmentation, which are just dark marks, as well as scarring. They can occur after you've gotten rid of your lesions, and they can remain on the skin for several weeks to months, sometimes years as well. So how to treat acne at home? Use non-comedogenic skincare products. These are some on the side. They contain salicylic acid, and salicylic acid is really good for keeping your pores not clogged so you don't